Right.
Now, the antibiotic research is one component of this, and let's mix another voice into this. On the line with us is Congressman Phil Gingrey. He is a Republican of Georgia. He is a doctor and a member of the Energy and Commerce Committee. He's one of two members of Congress, the other being Henry Waxman, who has authored legislation that would deal with spurring pharmaceutical companies to develop more antibiotics. Congressman Gingrey, thanks very much for being with us by phone this morning.
Well, Susan, thank you very much. I'm glad to be with you and have the opportunity. It's good to see Dr. Fauci and to discuss this very important issue.
Well, a question for you. There's so much concern in Washington right now about additional government spending, but this is an area where you, as a Republican, as you're coming into the majority, want to see increased attention from the federal government. Can you explain why it's a priority?
Well, it's a priority for the very reasons that Dr. Fauci just mentioned at the beginning of the show. That the emergence of antibiotic resistance bacteria, such as the methicillin-resistant Staphylococcus aureus, but there are many others. There are bugs coming back from Iraq and Iran. Our troops are exposed to crowded conditions and in the sand a lot, and more we're seeing these drug-resistant bacteria. Some have this so-called New Delhi gene, which allows them to mutate very quickly despite any new wonder drug, and all of a sudden you've got antibiotic resistance and no way to treat. We have, because of this, through the Energy and Commerce Committee, I introduced a bill called the GAIN Act. GAIN, of course, an acronym for Give Antibiotic Incentives Now. It's a bipartisan piece of legislation co-sponsored by Gene Green of Texas, Ed Whitfield of Kentucky, Diana DeGette of Colorado, and Mike Rogers of Michigan. We really hope, Susan, that this will answer the problem of why pharmaceutical companies are not developing new antibiotics. And over the last 20 years, when you look at any 4-year period, the number of new antibiotics that have come on the market, the last measure was, I think, 5, and that's a rapid decline, and there are many reasons for that, and we can discuss that as well.
Well, let me just get one other perspective on this. We've got a chart here that I can put under our camera. I'm sure you can't see it, but you're well familiar with it. This is from the Infectious Diseases Society of America and Food and Drug Administration, and it's two charts. One shows the number of antibiotics that have been approved for sale, which is, as you suggested, has been going down rather dramatically from the 1980s till the last 2-year period. But it suggests in a side chart with this that the number of clinical trials underway without the legislation you've suggested is really picking up. From the last 10 years, it went to somewhere in the neighborhood of under 20 now to about 45 or so. So it looks as though pharmaceuticals are getting back into the business of searching for drugs through clinical trials. Why is your legislation needed?
Well, Susan, that is a great question, and I think what's happening is and we have talked with a number of pharmaceutical industries, companies, both large and small, and we know for a fact that chart on the right that shows clinical trials increasing, that some products are actually even almost to the point of bringing to market, getting final approval, but these pharmaceutical companies have put the products on the shelf. And the reason they've done that, and Dr. Fauci may want to comment on this as well, the 7-year period of exclusivity does not really give them enough time to recoup their investment, and this becomes a market-driven problem. So we feel that in this GAIN Act, where one of the main provisions is to extend that time of exclusivity from 7 to 12 years to give them an opportunity to recoup and make a small profit. Also in the bill, of course, is to streamline the approval process and to work closer for the companies to be able to get information at the front end from the FDA in regard to what type of clinical studies they require, so the companies don't waste time and energy and money going down the wrong track. So that, I think that answers that question, Susan, but that's a very good point you make.
Congressman Gingrey, we asked you just to be with us for a few minutes. We know it's a district work period for you for the holiday. Thank you for adding your perspective and about the legislation that you hope to propose and promote in Congress. We'll see you when you get back to Washington.
Well, Susan, thank you. Very quickly, just let me say how pleased I am to hear from Dr. Fauci and his work as director of the National Institute of Allergy and Infectious Disease as part of the NIH and the Department of Health and Human Services. He does great work, and I've enjoyed having him testify before the Energy and Commerce Committee in the past.
Thank you, sir. Appreciate it. Have a good holiday.